Hey, I'm Dr. Joe, and today we're going to be discussing neck pain and common reasons for neck pain, and we're going to go through some treatment protocols. So here we have Luisa, and with Luisa, we're battling with just some general tension. She works out a lot, so there's always tension into the neck, the shoulders, the traps, and some of it's due to some posture-related stress, some things due to a little bit of stress-related, and then just general workout tension. Very common on a lot of people coming in with neck tension. This neck tension obviously can lead to stiffness, lead to just general discomfort, and can lead to chronic headaches. So what we're going to be doing some muscle release, specifically ART, which is active release. One of the specialties that I have, just holding down the muscle, working the muscle through range of motion, gets in there fairly deep, breaks up some scar tissue, breaks up muscle adhesions, and releases the muscle. And then you're going to watch me doing some adjustments on her neck to decrease some of the joint discomfort, and hopefully she'll be feeling a lot less discomfort, more range of motion at the end of our session. All right, so I'm gonna put a little bit of cream onto her neck just because I like to add a little bit of slide while I'm doing some muscle work here, and it incorporates some release of muscle tension, increases blood flow, and just helps relax the patient prior to getting adjusted. Even for myself as a chiro, I never really like just getting adjusted. I also love muscle work getting done before that. So we do that in our office just because, muscles attach to joints. And unless you release the muscle, you're really not getting the full effect of the joint release.
This feels good, by
So I'm just working her muscle, upper traps here through a range of motion as I'm kind of sliding through the area, really just honing in onto the fact of opening up the muscle in the seated position. I like treating in a seated position as well as in a lying down position, just so that it takes away some of the gravity stress when I'm also working on the neck with her lying down. So with neck pain, not only are you working on the neck, you're working on muscles all the way around the neck. Middle traps, rhomboids, levator muscles, upper trap, scalenes, cervical paraspinal, suboccipitals. There's a lot of muscles. So if anybody's giving you a massage at home to relieve your stress, there's a lot of muscles that you need to work on.
the way. My lower back crack when you did that.
No. There we go. Treat the neck, you get the low back involved as well. Now, even if someone has pain on one side, it's always best to clear up tension on both sides. So we're always working on the neck equally, even if someone says, "Oh, I can't turn to the right," or "My right side is worse." You got to work on both. Now, Louisa here can take muscle work fairly hard. She enjoys like a really deep massage work, so I'm going fairly deep on her. But like anybody, you always have to ask, how's the pressure, how's the tolerance, and go to their need. Okay, go ahead and lie on your back. All right, so let's just move the camera here. All right, so you can see here, Luisa is lying here nice and comfortable. And now we're going to be working on the neck in a different angle. With her off of gravity now, it tends to release the muscles, and I can get in there a little bit nicer now. And work on different muscles a little bit closer to the occiput, which is the top of the head, specifically the suboccipitals muscles, which is the muscles right at the base of the skull, and that leads to a lot of tension headaches. So if you ever have tension headaches that wrap around the head, or you feel a lot of pressure at the back of the head, usually these muscles need a good working on, and sometimes the joint needs to be released as well.